Hypertension by Kobe Auclair and Rachel Cuthbertson. In normal or regular blood pressure, blood leaves the heart through the aorta, which then branches off into smaller arterioles. From there, the blood tapers off into smaller capillaries, supplying the body with oxygen. The blood circulates throughout the body back to the heart through the vena cava. Blood pressure is the measurement of force applied to artery walls. Hypertension, also known as high blood pressure, is a common condition in which the force of the blood against your artery walls is elevated, and your heart has to work harder than normal to pump blood through the vessels. Normal blood pressure is in a range of 90 to 120 over 60 to 80 millimeters of mercury. Prehypertension is greater than 120 up to 140 over 80 to 90 millimeters of mercury. Hypertension is 140 over 90 and greater. Risk factors for hypertension include family history, age, typically over 40, being overweight, being African American, women on birth control pills, excessive alcohol consumption, smoking, and a lack of exercise. Symptoms. Most people do not experience any signs or symptoms of hypertension. This is why it is called the silent killer. But some people may experience dizziness, vision problems, headaches, or shortness of breath. The cause of hypertension is often unknown, but one common known cause is atherosclerosis. Atherosclerosis is where plaque builds up in artery walls. Blood flow decreases as the plaque enlarges, and blood cells can stick to the plaque and form solid clumps called clots, reducing or completely blocking blood flow. This makes the heart have to beat more frequently or increases the strength of the heart's contractions. Reduced blood flow and artery damage leads to conditions such as heart attack, stroke, or kidney disease. Other causes for hypertension include abnormal aldosterone and cortisol production from the adrenal glands or renal failure. The proteins involved in hypertension include antidiuretic hormone, also known as ADH, which is released by the posterior pituitary gland that stimulates the kidneys to absorb more water, causing blood pressure to increase. Aldosterone is involved in the renin-angiotensin-aldosterone mechanism, which causes the sympathetic nervous system to release renin. Renin converts angiotensinogen in the blood to angiotensin 1. Angiotensin 1 is converted into angiotensin 2 using the angiotensin converting enzyme, also known as ACE. This causes the adrenal cortex to release aldosterone, which stimulates the kidneys to reabsorb sodium, and by osmosis, an increase in water absorption occurs, which will increase blood pressure. Lastly, atrial natriuretic peptide hormone, also known as ANP, is produced by the atria of the heart, which causes the kidneys to secrete more sodium, and as water will follow, blood volume will go down, decreasing blood pressure. When the body contains excess extracellular fluid because of increased water and sodium intake, the arterial pressure rises, and the rate at which water and sodium are excreted by the kidneys is increased. In situations of increased extracellular fluid volume and a resultant increase in cardiac output, all of the tissues of the body are exposed to the same increased extracellular flow. This results in a generalized constriction of arterioles and an increase in both peripheral vascular resistance and blood pressure. Blood vessel resistance is friction within your arterioles. The more resistance you have, the higher your blood pressure will be. There are 3 different ways of altering your resistance. First of all, the diameter of your blood vessels, specifically vasoconstriction and vasodilation. Secondly, the blood viscosity, or how thick your blood is. And last, the length of your blood vessels. Treatments for hypertension include lifestyle changes such as exercising, quitting smoking, losing excess weight, limiting alcohol intake, and eating a balanced diet. Specifically, a diet with less sodium and less processed foods, because sodium causes the body to retain water, which increases blood volume, which in turn increases blood pressure. Medications for hypertension include diuretics, ACE inhibitors, beta blockers, angiotensin 2 receptor blockers, calcium channel blockers, and direct-acting vasodilators. Diuretics help move sodium and water from the blood to the urine, thereby decreasing blood pressure. Beta blockers reduce the workload on the heart by decreasing the rate of the heart and the strength of the heart's contractions. In summary, homeostasis is affected by hypertension due to elevated levels of blood pressure. Proteins including antidiuretic hormone, ADH, and atrial natriuretic peptide hormone, AMP, are involved in blood pressure regulation, and the receptors for these proteins/hormones are located in the cell membrane.